I would say that's probably one of the biggest questions I get asked. What's the difference between an optometrist and an ophthalmologist, or a pediatric ophthalmologist for that matter? And there's actually a pretty big difference. A doctor is not a doctor is not a doctor. There's a lot of different kinds of doctors, and that's where the blurriness kind of happens. If you look at it from a timing point of view, there's a lot of additional years of schooling that a medical or an eye doctor goes through that an optometrist doesn't. An ophthalmologist or a pediatric ophthalmologist goes to college, then goes to medical school, then does an internship and a residency for 4 years, and then usually does 1 to 2 years of additional training to become an eye surgeon and a medical doctor for the eye.
Is it a question amongst us?
We know a lot about growth and development of children. We have a very wide medical background. Medical diseases for the body frequently affect the eye, and those are things that we learn about for years. And so that breadth of medical knowledge is pretty important when you're dealing with children in particular. They aren't just like little adults, but they're kind of unique small people, and they have their own host of medical eye problems that can happen. Pediatric ophthalmologists know all those things.